permanent. Yeah.
Like we are living my bedroom, it's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. Cause today is me, tomorrow might be you. Cause no condition,
The condition is permanent. Yeah.
cause no.
Yes, indeed, no condition is permanent. That's just where they say good evening and welcome to the program Body Tok. We come to you from the Society for Radio Democracy, 98.1 FM. Body Tok, they come to you every Thursday from 5 to 6. And inside the program Body Tok, we talk about different sickness within the cause and treatment, signs and symptoms, and self-prevention. And we always to get experts them at the studio for talk about different sick them. And inside this edition of the program, my studio guest na Mohammed Yayaba, the resident doctor internal medicine department, University of Saloon Teaching Hospital Complex. And today we look at the safety of your kidneys, everyday habits that can slowly damage them, and best practice to keep them safe. Remember, say yourself when they listen and watch we live on our Facebook page, you get chance for take parts in the program by way you go text on the number 077-981-981, and later inside the program you go call and make your contribution and ask questions about things we talk about inside the program. We get for do with kidney. And remember, say maybe they bring you this edition of the program Musa Kamara Naminim. My studio guest Mohammed Yayaba, resident doctor internal medicine department, University of Teaching Hospital Complex. Good evening and welcome to the program Body Tok.
Good evening, Musa. Good evening, people in Radio Land. And as Musa rightly said, I'm Dr. Mohammed Yayaba, a resident in the Department of Internal Medicine.
Okay. And followers of Radio Democracy, Body Tok, gonna say we get quiz every Thursday based on what we discussed in the last program. And last program we been talk about comprehensive pregnancy care within all women we na belle woman for now. And we from that program day, inside the edition of the program, we ask say what in na the specific thing them for le belle woman, what na the specific time for we belle woman for join clinic. And the question to say, what in the routine test them we belle woman for do and why if for do them? We mean say, we person get belle, who's test them it go do and why if for do them? And the three say, what in the doctor in name and in position? What in the doctor in name, position and institution? I mean the doctor who been get last week. We've been talking comprehensive pregnancy care and what everyday woman should know. Remember, say you are the answer. Any question we answer, you get 50,000 leons top up. Any question we answer, you get 50,000 leons top up on your phone. And our University of Saloon Teaching Hospital Complex, they support Radio Democracy for sake of this quiz. Waiting at the specific thing them. Waiting at the specific term for le belle woman join clinic. Now question 1. And 2, waiting at the test them where belle woman for do and why for do them. 3, waiting at the doctor in name, position and institution. With that, I come to me studio guests now the program. The phone line don't open now. We go call on 077-981-981 and answer then quiz questions there. So you will the winner, you they get top up now your phone, and we do go for break. We join with studio guests. The program will Body Tok. They continue.
Daily courage. No condition.
The condition is permanent. Yeah.
No condition.
condition is permanent. Yeah.
No condition.
No condition is permanent. Yeah.
No condition.
No condition is permanent. Yeah.
Like we are living.
The number is 0779819181. Call and answer to the questions then we don't ask inside the program Well Body Talk. You get yourself 50,000 leons credit. If you just join, we will get a caller on the line. You name and who say you the call from Well Body Talk.
Name Zakaria, I call from Godrich.
Zakaria from Godrich. Yes. Whose question you want to answer?
Question 1. When the low man start the clinic.
When waiting?
The low man go there for start to the clinic.
Yeah, now when?
For 2 months.
From
2 months.
2 months?
4.
Okay, make us see if that's correct. You know get from Godrich. It's not correct. We get another caller on the line. Your name, who said the call from?
Hello, good afternoon.
Yes, good afternoon.
How are you?
Yes, I'm good. And you?
Question answering.
Yes.
The doctor in name,
Yes.
maybe Dr. Abraham Kanu.
Go ahead.
Dr. Abraham Kanu.
What's in position?
Now, obstetrician and gynecology.
Okay. Whose institution you come out?
Now, university medical school.
Okay, that's not quite correct. Now, from university teaching hospital complex, you come out, but to go give you because you know the doctor in name, you know the institution, and also in position. We go give you that one.
Thank you very much.
Congratulations. After the program, we go send you credit.
All right, thank you, sir.
Thank you very much. And that's now the winner. I mean, please, I will take other call, make her write down that number there for the credit for the winner of that one day. And so I no go mix them up. 077-981-981. Call and make and answer any one of the questions then. And this one, okay. 451. Okay. 077-981-981. We'll get a caller on the line. You name who said the call from?
Info the Kumar, they call from this station.
Okay.
I want answer question.
Question 1, yes.
Yes. Where do you want to go to hospital?
Yes.
Now 10 to 12 weeks. We don't notice the pabele.
Correct. Yeah. Congratulations. Okay. So we don't the quiz for today. Done. Now so we end the quiz for today. We need to pick more calls again because they don't answer the questions. Then we only get 100,000 for giveaway per week. This now for encourage we listeners them for be aware and create awareness in terms of anything we get for do with well body and make we do that. Plenty thank you for where you call and you able get them correct. So they take down the number of the winners them immediately after the program. We go send una top up inside. So yourself when you listen, you can take note of today edition, and because we get for ask from this program, we will give away credits them again to we listeners then. This is a part of Radio Democracy and the University of Salon Teaching Hospital Complex for create awareness about well body na the country, and by doing so we hope say people go pay key attention on things and movie they talk na the program. Actually, we studio guests, you don't be quiet now the studio for a long time. Good afternoon again, good evening, and welcome to the program Well Body Talk.
Yeah, Mr. Good evening again.
Good evening, yes. We dey talk about the kidney, and my doctor for today na Mohammed Yaya Ba resident doctor, internal medicine department, University of Salon Teaching Hospital Complex. Today we talk about safety of kidney, everyday habits, and waiting person they do with the damage the kidney and how you for keep them safe. We topic for today. But you yourself don't witness the question and answer as perspective of and I see they smile.
Yes, it's so interesting. At least this nice. It will make people become more attentive on the subsequent program the way they go on. So that's really nice. And the way how people and they answer the questions, you know, say a lot of people and they will be pay attention for the
yes,
last
of
program.
course. And one for say congratulations to all the winners them. And you know, we better luck next time. We value una all and we appreciate una efforts them for always they listen to Radio Democracy programs them, especially Body Talk. Today we will talk about the kidney. We'll talk about kidney. What will they talk about in medical term?
Yes. So a kidney is just one of the organs they organ in the body. Just like how we get the heart, we get the liver, we get the eyes. Now, so we get the kidneys. Interestingly, the liver will just get one, but the kidney will get two. And then they at the side of the body, just at the side of the belly part. Now that part then at the kidney, then you get one at your right, you get one at your left. For most people, all two they work perfectly well. For some, now only one they work. For others, none of the two no they work. So this is the kidneys.
Okay, for some, one they work. For some, two they work. For some, none they work. We can look at advantage and disadvantage of these, or waiting this mean if person kidney one they work, one they work, or two they work, or two no they work. But first of all, now look at what's the role of the kidney.
Okay, that's very important. All the organs in the body then get their own function the way they serve. So for the kidney, it gets several functions them where they serve. One of the key functions where the kidney they serve now for remove waste from the body. A lot of waste where the body they generates, we refer to them as toxins. In the way for say they're dangerous to the body, they cause damage, they will make you sick. But the kidneys they filter the blood and remove all the waste in there, and then you remove them from the body. The kidney also they help you for balance your water system where you get in your body. So for instance, you dey drink a lot of water, but at the same time back, you dey wet some of the water. Okay, you dey pass urine. The kidney then they balance that. Some of the water it dey stay in the body, the other water, the kidney they make excrete them. Okay. Another thing the kidney they do, it help you for regulate the salt content in the body. Because the body don't want too much salt. So what in the kidney they do, it creates a balance. Some salt, you pull out. Others, it remain at the body. What no more the body need. The kidney also, not only for excrete and for remove waste, they also they produce important things the way they help you by your body. So one of the things that the kidney they produce, now what we refer to as erythropoietin. This is a hormone where they help for form your blood. Okay? You red blood cells. So now the reason that they make at the end of the day, if person gets serious problem with in kidney, they find out say always they say this person in get low blood. And anytime we go to hospital, they must put and say, okay, listen, we need to get 2 pints blood, as so on and so forth. So the kidney now also they help for produce that particular hormone they for help the blood level they go up. Another thing where the kidney do is very, very important. Now for help for maintain your blood pressure. Okay, so the kidney they produce something we call renin. Okay, that renin it also they help for balance for the water. All that they help for manage and maintain your blood pressure to the normal way it's supposed for the. So the kidney really they play vital roles in the body.
It seems as if now the engine for like almost one. Is that the case?
Well, in the motor man, we get the main engine when at the heart. Okay, the kidney ain't not to like the engine per se, but now one of the organs then where they help the body fully function properly. Okay, but the main engine of the heart of the body in the heart. Yes.
Now, let we look at, you talk about salts. The kidney, they help regulate the salts level in the body.
Yes.
What kind of salt do they talk about? Is it this salt where they eat or any food they would eat where they produce salt?
Yes. So this local salt wey dey eat wey na sodium chloride, this common salt, okay, in na one of the salt wey we dey talk about. In fact, na the same salt we dey talk about. The only difference is you dey get this one wey dey sprinkle per the food wey dey put for follow eat. Some food dem dey wey dey eat, they already don process and then put am there. Okay, even this maggi wey dey eat, because a lot of times
white maggi or jumbo or which kind maggi we dey talk about?
the name dem na dressing normal.
Na the same.
To be honest with you, most of the maggi they already come now in our country, it's full of salt. Okay, and I don't know for which reason, but we dey observe say now e no easy for a person cook, he put 1 or 2 maggi. People they put 4 maggi. E go surprise wetin people in the tell in our hospital. They ask how much maggi they put for where they cook, how many cup plus as where they put. Some man they put 5 maggi, some man they put 6 maggi. That maggi get full amount of salt. Okay, so a lot of people can say salt, like you just focus no more on that white substance where they sprinkle, but maggi also get a lot of salt.
What are the danger of if salts dey na the system and the kidney no dey function well?
Very dangerous. In fact, they make you they get too much water in the system. It damage the kidneys. It make your kidney they know they work properly. And
Maggi?
Yes, and it also make your blood pressure the shoots go up. Very very dangerous something. Your pressure will go up, your kidney they function fine. In fact, your overall health system will function fine. At the end of the day, you will be in all kind of problem. You will get heart problem. At the end of the day, of course, your kidney then go back.
That's if you dey take excess salt.
Yes.
What in na the level of salt wey somebody for take wey go say this is normal for the kidney operation or this is above the level?
So sometimes it can difficult for estimate the exact amount of salt we person for eat per the day. You understand? But a lot of times we, like for example, most of the maggi they come, some of them even they even know the amount wey dey inside. Okay, so now make we can advise a lot of the patient the way they come. Like for example, people already who don't know say they get kidney problem. Most of the time we tell them totally avoid salt. That's what we can do. Whereas for others where they at risk, we dey tell them for let them reduce the quantity. This is the thing.
Now we can look at the thing the way somebody for do for care for the kidney and wetin dey damage the kidney. But earlier in your statement make mention say we get 2 kidney, yeah.
Yes, sir.
And some can lucky or 2 dey work, some na 1 dey work, and some none no dey work. Now we start in a situation where somebody get 2 kidney or 2 dey work. Wetin that they mean and how important that they dey?
Yeah, interestingly, you actually need only 1 functional kidney. One way they work perfectly is fine. You are good. You don't necessarily need all 2 for be perfect. You just need 1 way they work for you perfectly. Then you are good. You know, there no problem. The problem is because of the amount of work where the kidney they do, now it make if you just get 1, it they overwork the 1. So they find out say even if you get machine, now 1 great machine no more, you always know that 1 great machine no more. The day way that machine they unbox, you don't get problem. So now it make we get the 2 kidneys. Where all 2 they work perfectly, you are in good shape, no problem. Because at the end of the day, then they complement each other. They work perfectly well. But at the end of the day, if you only get some people and they even born there with 1 kidney. Yes, it can be congenital. Some people and how can you even know that day now where they can send them say go do scan. Where then go do the scan, now 1 kidney then see. They defend the other one in Asia. They say, well, this now so it come, now 1 kidney get. But you know, get no problem. Then kind people and they get for be careful. Because the moment where that 1 kidney they get injury, that's it.
So let me ask, is it worrisome if 1 kidney they function 1 left or somebody born with a single kidney?
Yeah, it is worrisome because at the end of the day, like I say, now 2 you forget where they work, where they complement each other. But if now 1 you get, you dey at risk. For example, that 1 kidney, anything wrong with them, Then by then you know get no kidney again wey dey use. But if na two you get, one dey hamburg, the other one still go dey work. Now make even the people wey can get all two wey no dey work again, wey dem can send them for go do what we call kidney transplant, wherein they go take they harvest kidney from one individual, then put am per other person. Now one grade one no more they harvest because they know say at the end of the day that one kidney wey get am, it work for you perfectly well. You just for be more careful when you get one functional kidney.
We can look at what you need for do, as you say, you just need for be careful when you get one kidney. If you even get two kidneys, you still get for be careful because of the let it to not get issue. But now we see a situation where somebody not get kidney at all.
You go get kidney, but they know
the function at all. Yes.
Yes.
I mean.
So then people and they now we refer to as then kidney failure, total kidney failure. Then people and they need artificial kidney for functional life, where we call dialysis. Without that dialysis, they not go survive because you don't get kidney. Your body they produce a lot of toxins when are very and a hard substance they damage the body. You get them kind of thing and in the body. You know they filter them. You know go survive. I'm afraid with that situation, the moment when they establish say kidney they all two don't pack, they need a function. You need artificial kidney we call dialysis. When a machine where they work just like how the kidney they work for just filter the blood. Filter the blood, remove the excess toxins, remove excess amount of water, so you go to function normally.
Now, if somebody get a single kidney or one of the work, what are the signs where they show say the one kidney get issue or this person don't get kidney failure?
Yes. So by signs, it's extremely difficult for you know if now one kidney they work or now all two don't know they work. It's difficult. Most of the time, all two the kidney can damage together. Most of the time. And what thing can happen? First thing first, most of the time in the early morning, the person they feel tired. You don't sleep all night, monitor is still tired. Feel exhausted. What mean by all the sleep while I sleep at tired like this? Another way the person they notice, they grab for wet na net fast. Sometimes, normally the person they grab maybe 1 or 2 times for wet. Then now the person will tell you say, hey doctor, me now I they grab 5, 10, 6 times for wet. Another way the person can notice, where they go for go wet, if they find out say the wet, it form like that soap, that foam, where you know that flush, where they form, where like if they broke that soap, where they wet now, so the wet together like foam. You say, this is not normal. Another thing again, where the person wake now morning, you find out say the face swell, the eyes and swell, the face puffy, and say, hey, it's mania. I face flop so sometimes they can refer to people and say, you get cold. Most of the time, they can start. They say this you get cold. Then begin starts for take medicine. By the time now they come to hospital now, both of the kidneys are gone. So now some of the signs and they another sign again where they happen to a person, the person will they get hiccups. If they find out that the person they get hiccup when they stop. They say, hey, where the hiccup say for drinking quarter they stop. If they drink quarter but the hiccup may stop. Then a sign say your kidney then they don't get issue. Another time again, you go to vomit. Persistently go to vomit, say, who's kind of vomit this? Most of them people and they go to say first and get malaria and typhoid. So say that they don't for treat them for malaria and typhoid and come between now the big institution them. At the end of the day now make diagnosis say my kidney I don't get problem. Another thing again where the person will notice, but then they pass the measure maybe routinely you will go by a screening program. They say one check blood pressure for people. The person always in blood pressure then at the high side. Young person, they never tell and say get high blood pressure. The pressure always in at the high side. That's not sign say the person they get kidney problem.
And what about when somebody in foot they swell and your body they feel puffy?
Yes.
Is that the sign?
That's a very big sign. Because like I say, from this beginning, the kidney in one of the main function is for remove excess water in the body, for create a balance. The water the body need is stay, the water the body no need to go out. So the moment your kidney then get problem, they're able for make amount of urine. In fact, now one of the other signs, the person will tell you say, me I know they wet. Or why the wet need to come out better, and a small amount they come on. Of course, as you rightly mentioned, not to the face no more they swell, the foot they swell, the belly they swell, all the parts by the body go swell. But again, we have to be careful. When person foot they swell, not necessarily means they get kidney problem, because we get all that disease condition them where they make person foot then swell, like we get heart failure, person we know they eat better, like malnourished person, all them people in the foot then go swell. Okay, even possibly get liver problem, in foot go swell. But anytime where the first part by the body will swell na the face, then na good indication say this na more of kidney problem they deal with.
If you just join with the program, well, Body Talk, they can to from 98.1 FM. Me will bring you this edition. Musa Kamara na my name. Me studio guest Mohammed Yayaba, a resident doctor in internal medicine department, University of Salone Teaching Hospital Complex. Today, they look at the safety of your kidney, everyday habits that can slowly damage them, and best practice to keep them safe. You mentioned, say, if somebody don't get a kidney failure, a total kidney failure, and you already use the artificial kidney when a dialysis. Of course, dialysis now hospitals them, the dialysis machine hospitals them ED. If somebody gets a total kidney failure, how often if they go through dialysis?
Ideally, the person for do dialysis at least 3 times per week. But
3 times per week?
Yes. But because of the cost we involve, a lot of people can only afford 2 times per week, while others only 1 time per week. To be honest, the less amount you do the dialysis, the more problem they run into. Because like I say, the body, they create a lot of harmful substances in the body where you need for take out. That make you see the pass urine. You dey all and day now, because if they stay in the body, you go begin get some form of seizure we call fix. You go body go dey jack. You go be unconscious. Okay, you go just dey like pass you dey in hospital. You go dey vomit persistently. You dey hiccup non-stop, you need stop. All that day now because of the toxins they in the body. And if you know they remove them regularly as the standard practice, where at least for be 3 times per week, then a problem. Some people only 1 times per week, 9 they able to afford. But the standard should be at least 3 times per week.
It's quite expensive.
Very expensive.
So that means if you person get kidney failure, you not get money, that's the end.
Unfortunately, that's the end. But the thing is, because of we don't get now dialysis center we dey in a government hospital, Connaught Hospital, a more affordable compared to the private facilities them, and a lot of people now they benefit from that.
For instance, how long somebody would they under dialysis?
Yeah, Musa, if you kidney them all to don't pack. If you not get opportunity for let them do kidney transplant, wherein they remove or harvest 1 kidney from another healthy person, then put am by your own body, of course, you will need dialysis as long as you're alive.
If they go through the process, how much hour you go take for clean the body, we go under the machine?
Dialysis, most times 2 hours maximum. And in fact, some people in the beginning, they can take longer time. Then as they go regular dialysis, 1 to 2 hours is enough.
Is it advisable or is it affordable for make somebody get in your dialysis machine house?
It is affordable. People in the way get them in their house, but there are very few. And dialysis is very expensive.
In salon context or elsewhere?
Well, salon context, I'm not aware of anybody who get machine and also dialyze. Even the most wealthy people, who they receive very wealthy patients, they can't hospital for can dialyze. But like I say, very expensive.
How often the transplants? Is it possible in a salon?
No, we not do any kidney transplant in a salon. In fact, we not get self the facilitate for do such procedures.
So now that's people can go do na Ghana or Germany or India.
Yes, a lot of Sierra Leonean them can go now to India. Again, the interesting thing, the transplant now the ultimate solution, but sometimes it fails. They give other kidney, but they work. Maybe even, along the line.
Even you buy them from somebody.
Yes, it is stop. They work, and then you still get for the dialysis again.
And is it readily available, or then get for pull and pan somebody you wanna go negotiate, or you can go hospital, you meet say kidney available, then you buy.
We get people where they write will. You know, say some people and they write will for house, they write will for them money where they get a bank. Others they write will for them body. Say what I die, me body I don't donate them. For anybody we need heart, we need kidney, let them give 'em. For other countries, they prioritize. They get what they look for. Like the younger you are, the more healthy. Because some people also kidney problem no more than get. They get kidney problem, they get liver problem, they get heart problem. You see, some people get what we call comorbid condition. You get kidney problem, you get diabetes. You get kidney problem, you get HIV. You get kidney problem, you get hepatitis. So then people and then they wait and say, okay, this one, you know, get HIV, you know, get now only kidney problem you get. Those people they prioritize them because if you give them the kidney, they get better chance for survive than the other individual.
But that depends on waiting kill somebody, or depends too. If somebody die, a kidney go function.
Yes, it take a long time before person they die. You know, the last part by the body where they die na the heart. So some people and they put them on machine, then try force. They don't confirm say yes, this person here na person really way in organ they are available for transplant. Okay, that particular person they preserve them. They preserve them. Then go na the operating table and harvest the organ then before they put her off machine. For preserve means they connect them to machine them for
them able sustain. Yes. Say they harvest the organ even if you don't die.
Yes, because they will need for the organ then go the function. If not so then because if the person don't die, that's not like they get oxygen, blood supply no they run, then the organ themselves no go useful.
So if somebody die, not just alone overseas countries and get that facility for sustain you, yes, or for sustain the organs and harvest them.
Yeah, we get stages of death. You understand? Some people they don't brain die, then brain don't die. You know go to reverse it again. Then people no other way no they for you return them back. Then brain don't die. It's just a matter of time for the other organ themselves die. Most of them people they go through them procedure then they. But for kidney, you don't necessarily need people who don't die for let them do kidney transplant. You can even take them from a close relative or somebody who is available for donating kidney. Okay? The person, like I say from the beginning, person get 2 kidney where they work, then go test out 2 they work fine. He can donate in 1 kidney for another person, in just go use in 1 kidney now. No problem.
Is it complex for transplant kidney?
Yes.
Is it dangerous if they pull kidneys per person? Is it possible the person go die in the process or he will survive?
Medicine we only use dangerous. It's complicated.
It could be from the different registers.
Yeah, the point here is the moment where they undergo surgery, you dey at risk. You might just die from the surgery. Okay.
Even if they remove the kidney.
Yes, you might just die. Now surgery.
For remove them from me for give other person.
Yes, you might die from the surgery. And they undergo such procedures, sign consent form. Wherein everything will be explained to you, what thing might possible. You might just not wake up again.
It's a dangerous, it's a complicated situation. I did learn the medical term. Yes. If you just join with the program now, Body Tok, it can say from 98.1 FM. You listen to Mohammed Yayaba in a resident doctor, internal medicine department, University of Salon Teaching Hospital Complex. Today we talk about kidney and what in person need for do for protect the kidney and what in are the daily habits where they damage the kidney. The program Body Tok they continue. We come to you on it seems as if the kidney is not precious something with somebody for maintain at all costs.
Oh yes.
What are some of the activities them way people can engage with and bog the kidney?
For the kidney, prevention is better than cure. Make sure you not go get kidney problem. It is better for you because the moment when they establish you get kidney problem, you are in a lot of trouble. A lot of resources they go, a lot of people in distress. For some people, they go even spend every penny they get. By the end of the day, they still able to sustain that because that's what you get for do for the rest of your life. You no able sustain, I go die. So prevention is the goal for kidney problem. So one of the habits them, I observe salon people are not like for drinking water. It is see person. Sometimes we can even ask people we can do random studies. We say from this morning, how many water we don't drink? This packet water they drink, a lot of them not even reach 500 mils. Then just write them. If you actually measure at 350 or 400, you need a lot of water for the day. At least for the day, for supposed to be healthy, if you drink between 3 to 4 liters per day. You know what I mean? 3 liters, that to take water, that long one. 2 of them are 3 liters. 3 of them are 4.5 liters. How many people?
That long one?
Yes.
If I drink
because
like
each one are 1.5.
1.5.
Each one. And then if you take another one, 2 that are 3 liters. Then 3 that are 4.5 liters. At least if you drink.
So if you drink that in 3
per day, for you are healthy, we not ever get kidney problem, not get heart problem. Because for people who already don't establish and get kidney problem, they cut off the amount of water they drink. Because the kidney already don't sick. They able for remove excess water in the body. If they add excess water, it will cause more damage to you. Other people in back who can reduce the amount of water in the heart. If you get too much water in the system, it will cause problem to your heart. If you already don't establish you get heart problem. But for perfect healthy person, not get kidney problem, not get heart problem. Then people they will drink at least 3 to 4 liters per day. That is one. Okay. One of the things then. Another thing a person will do, reduce the amount of salt they eat. A lot of time you don't necessarily need for it for put how many 3-4 Maggi. Just one is enough. Just one, the good one, is enough. You don't need extra. Another thing a great person will do, if you not possibly get high blood pressure, make sure say you dey take medication for your high blood pressure. Because if you continue to get high blood pressure, it will damage your kidney. Okay, it's very important for you maintain. A lot of people when they get high blood pressure, they can feel say na malaria they get. He say, doctor, I don't take the medicine, but I don't stop. I say, why you stop? He say, my pressure don't normal. That is a problem. The moment your problem, the way your pressure don't normal, now the best time for even take your pressure medicine. Because you maintain and now at that normal stage. Now it make possible get high blood pressure if you go to hospital regularly. Because we don't establish you not possible get high blood pressure, we call hypertension. We don't put you on medication. In the kind of hospital, we check your pressure, it is at the very normal side. Maybe the amount of medication we get will reduce them, but we no dey ever stop them. Because when you stop them, pressure will shoot up as I be dey safe, and that is a problem. Another thing again, we person for do for preventing or get kidney problem. If you not possible, then say you get diabetes, that sugar sick, we get high blood sugar. If you get diabetes, make sure say you take your medication and you adhere to all the doctor advice for preventing sugar not go to go up. The moment where they get high sugar, you go get kidney problem. Another thing again, when now the problem now where they happen in salon, a lot of people they take medications where they not prescribe. You load pa puda, you load pa balls, any kind of mutka we load pa now. Even small mutka now, they see the advert medication.
And some of them they get names, they wouldn't they call them say if you get kidney problem, this could clear the heart, it could clear the kidney.
Most of the time na lie.
But people they buy.
People they buy. This is the problem. People well now one of the good things who they get in kind of program they are for educate people they understand. Na lie. Most of the medication where they sell, if you check the medication, especially the pain medication, then go say na pain, all kind name they give the medication for pain. By the end of the day, if you watch that medication, what are the main thing go that medication? Now a drug we call diclofenac. Diclofenac now one of the drugs them where they under a group of drugs who we call the NSAIDs. Okay, and the NSAIDs, these are medications them where people they use for pain. Very very good medication. You get that you take them, you go better. But if you don't use them, if you don't continue to use that medicine for chronic time, meaning for a very long time, you go end up for get kidney problem. In fact, right now one of the leading cause of kidney problem na salon. Because lots of people they take a lot of people just they take pain medicine left and right. They not prescribe them for you, you just they go by. Any corner where you go, you say you get pain medicine, you know they even know now kind pain medicine. So now the reason they make, I take this opportunity for encourage people even if na pain no more you dey feel, please come to the hospital. Let them prescribe for you the appropriate medication wey go help you.
What about these energy drinks? Some energy drinks that people dey drink.
You know, energy drink dem get what we call caffeine. This caffeine is dangerous for the kidney. So this na another thing wey dey cause kidney problem. So just like as you dey fasting for the use dem pain medication dem, if you dey fasting for the drink energy drink, some people dem lay like students dem wey dey na college wey no wan sleep, they take this energy drink, then sef at the end of the day dem go damage dem kidneys.
Okay. The program now, Well Body Talk, in the country from the Society for Radio Democracy, 98.1 FM. And they listen to Mohammed Yaya Ba, resident doctor, internal medicine department, University of Salon Teaching Hospital Complex. Today we'll look at the kidney. You self will listen can call on 077 981 981, 077 981 981. Don't forget, say next week we'll get for ask, we'll get quiz again on what we talk now. We'll say we'll get for ask people for answer some of the things that we discuss now the program, and you go win yourself to pop like how the one them we don't win 50,000 or 50 leos to pop today. 077 981 981. Call and make a contribution inside the program. Well Body Talk will come to you from the Society for Radio Democracy, 98.1 FM. 77981 Please no flash the line because other people go on for call. But if you dey flash them, the person away will call. We'll get a caller on the line. You name who said call from Well Body Talk.
Yeah, good evening, sir.
Yes, how do you evening?
Thank God. I want to ask, which are the normal water way for drink, where it will be fine for somebody where you help?
Okay. Normal water we passing for drink. You mean the amount of the water?
Yeah, amount of water where they drink.
Okay, we don't answer that, but we go talk on again.
Okay.
Thank you very much for call. Well Body Talk 77981 You name who said call from Well Body Talk.
Yes, Mama. Good evening, Mama. Thank you.
Yes. Your contribution.
Yes. Quickly, I want to know if all the energy drinks they damage it. Or
Okay.
anyone where will specify on all energy drinks no more possible for drink for the kids.
Okay, thank you very much. And 77981 call and make a contribution inside the program Well Body Talk. We'll come to you from the Society for Radio Democracy, 98.1 FM. 77981 We'll get a caller on the line. You name who said the call from? Well Body Talk. Yes, you name who said the call from?
Hello?
Yes, we'll get you. You name who said the call from?
The Freetown. If somebody gets a kidney function of 41 to 45, which are the amount of water we is for the drink?
Okay, thank you.
A GFR of 41 to 45.
Okay, no problem. Okay. Yes. You never we said a call from Well Body Talk.
Yeah, the call from Allentown.
Your contribution.
When you get kidney, how you don't say you get kidney problem? How you don't know which are the symptoms when you don't know say you get kidney problem?
Okay, no problem. Doctor will answer that. Andy. Okay, that's another call on the line. You name who said call from Well Body Talk.
Hello?
Yeah, you name who said call from.
I name Sheku J. Sanko Matam.
Okay, Shaku, your contribution.
Now we did call that by this ulcer business, ulcer.
Not to ulcer will talk today unless the doctor say ulcer get relation to kidney. But today we talk about kidney. Okay. Thank you.
Okay, thank you.
Thank you very much. 77981 Now the number for call. We will stop for pick the calls them, make doctor answer to the first set of questions them we don't ask. Please make we answer this last one first for now. You never will say the call from Well Body Talk. Yes, your contribution, Abdul Salam.
I think some people may take medicine for
Salam. Plenty questions then don't come for you. you can respond to them as you take note of them. But I will make we start with this one. We talk about the heart functioning of 41 to 45.
No, the kidney.
The kidney, rather. I beg your pardon. And the amount of water we somebody for take.
Yeah. So this person, where you go now hospital, they send you for go do kidney function test. So where you do kidney function test, most of the time they calculate what we refer to as the EGFR. All the other letter in a capital, but the E in a small letter. So the EGFR, now they estimate how much amount the kidney they filter. You understand? So you get different levels. For very normal, if they at least 90 and above. Okay. Through that EGFR, then get the staging of kidney disease. We get stage 1, stage 2, stage 3 we get stage 4, and then the end stage, when at stage 5. Okay. For person we get EGFR 40, 45, that person at stage 3. Okay. For some people, EGFR is not 100% means say because of a lower, you already sick kidney problem. People never understand. EGFR, it gets relationship for do with even your ethnicity. For we the blacks, it gets effect on them. Another thing again where they play on na you age. For ageable somebody, people already now above 60, 70 years, you no go ever see the EGFR they at that very normal rate. Okay? So you get for look all learning into consideration. You no go just see EGFR, you say, oh, this person get kidney problem. You know they work like that. Okay? The only thing they tell you say even as you the age, if you see the person on the old, that's what the organ and the old. The heart they get the heart the age, the brain the age, the kidney self the age. So the amount of function where the kidney will do today, you know they able for total now again. So for them people then they decrease the amount of water they drink. It's advisable for such people where they now at 40, 45 and at stage 3, let them be between 1.5 to 2.5 liters per day.
Somebody that ask normal person we no get kidney, no get problem, most water for a drink amount.
Yes. This person need for listening, we're gonna have something we don't discuss. It's very important for no. Like I say, for very healthy somebody, we not get no problem. Problems not only from kidney, in kidney they function fine. You not get heart condition, you not get liver problem. This person can drink between 3 to 4 liters per day. Okay? Yes, sir.
More questions them day for you the program.
Yes.
And okay, I think you don't answer most of them. We go open phone line again, 779819181. Who say you go call? Okay, Modi.
Yes.
Okay, go respond to them before.
So somebody asked about energy drink.
Yes.
I'm afraid for disappoint that person. The all energy drink. No one know they would exclude. All energy drink, they all get problem because you watch their content, you get caffeine, and that is dangerous for your kidneys. So it better you drink less amounts of energy drink or you avoid them totally. That is better for your kidney health. And somebody asks about the signs and symptoms. Something will be already mentioned.
Yes. So
like I say, I just summarize that now. One of the first thing they see for person to get kidney problem, the person will be very tired in the morning. The person will go sleep all night, don't monitor, very tired. Another sign again, we're going to see get kidney problem. We then go check your blood pressure, it is very, very high. You know, you look, you see yourself like say healthy, but blood pressure that high, and then not to the machine faulty, not to the person we measure and not sabi. Every factor they don't take into consideration, but blood pressure still high. That's a very important sign. Another sign again, na person they grab for wet nanet fast. They increase the amount of time we grab nanet. Maybe you normal na 1 or 2 times. Now they grab 5, 6 times for wet nanet. That's the sign. Na signs you get kidney problem. Another sign again for kidney problem. Now we grab na money, find out say face what we call puffy, face flop. We watch na the mirror. How me face flop so? Na sign of kidney problem. Another sign again of kidney problem. Now when they wet, you find out say wet, it make like foam, okay, like soap. It just rise like that. Say, this is a sign of kidney problem. Another sign of kidney problem again. Now, possibly the amount of wet where they wet, it all reduce. Normally, you know where they go wet, the quantity where they expel. Say, now why they wet? The wet may come out better. Now, sign of kidney problem. For some people, they know they be wet at all. They never make no urine at all. If they go to that for wet, nothing come on. na sign of kidney problem. So a lot of signs dem dey of kidney problem. Sometimes you go wet, na blood dey comot, that na sign. Other sign dem dey wey not too specific, like when your foot dem dey floor up, your belle dey swell, all your body dey swell. Then they self can point towards kidney problem, but it gets other causes them as well.
Now, somebody they ask if ulcer get anything to do with the kidney.
Not really. The thing now one of the disease condition we get for can discuss, because a lot of misconception there about ulcer. So much misconception. In fact, now everywhere anybody you see get ulcer, say me I get ulcer. So as I'm talking for discuss, but in real terms, unless you get an ulcer, where you get yes now ulcer, don't the ulcer they bleed, meaning this ulcer where you get, because ulcer na wound. Not like so foot where you wound now you got then they mean ulcer. Even where you wound now in hospital na ulcer okay if I do. But if you wound now you got okay now we call ulcer. You get different parts there where you go wound. If you wound, don't the wound they bleed. Okay, it they reduce the blood na the system. And some people they bleed so much that the kidney need enough blood supply. One of the organ if you the body one sick, the body they say nothing me I supply me kidney. So the kidney they can always prioritize them. If the kidney now they bleed, your amount of blood don't reduce, you know they get enough blood supply to the kidney, definitely go get kidney problem. But now in extreme of ulcer patient, not to any kind of ulcer person go get that kind of relationship.
Not a beginner.
No.
Hello?
You never was said call from Body Tok.
Yeah, hello?
Yes, you never was said call from Body Tok.
I wish you go. They call all the way from Pepel.
Yes, from Pepel, put local. Your contribution?
Yes, sir. I can ask one question because we don't know what to talk or know what I can analyze already. But I'll let doctor tell me one thing. I guess from till the morning, I'm like somebody who get ania, like that ania, enough strong to that way, you know. But I don't know how possible work for life with self. I said, like the next week it take, right? Stay strong, you know, for go do operation for you.
Okay. We dey discuss today kidney, but since doctor there they deal with internal medicine, maybe he will advise on that if he wish.
Okay, sir. Thank you, sir.
Thank you very much. From
Thank you.
Kamasondo Chiefdom Pepe. 7798198. We'll get another caller on the line. You name me said call from Body Tok.
Good evening, sir. How are you?
We do fine, and you?
Yeah, fine, sir. You concerned citizen.
Concerned citizen, your contribution.
Print out.
Okay.
I tell doctor, take it for the good work we do. I get two concerns.
Okay.
One, we talk about the West fast as a kind of kidney problem. But also I know if at all sometimes prostate enlargement prostate gland cause any the same symptom. I don't know if you get a gearing to that day.
Okay.
Number one. Secondly, is a concern where our we people that are applying this a sort of advocacy because all doctors make a way through Ministry of Health. People in a provincial center area. They don't get that kind of facility. They play. If they don't get way for Ministry of Health program happening. Thank you very much. Blessed day.
Thank you for your contribution inside the program Body Tok. Doc, you can respond to the questions that they will don't send inside the program. Wouldn't they ask?
Yes. Thank you very much for the people that already call. We appreciate you so much. Somebody they asked about Anya. So as they introduced me na internal medicine department I did. We then support the internal medicine department. You know, get anything to do with operation business. Okay, hernia na operation problem, but the person need guide. It's very simple. Please, can Connaught Hospital we get a very good surgical team. Then go take care of that person there for the hernia. So now the advisor never go get the person. Somebody they ask about prostate. Interesting. Prostate problem. You know, for prostate now like I will get the kidney instead of an organ within the body. prostate na one we get. And na man no more get prostate, woman they no get prostate. So na man no more will get prostate problem. Prostate as with the age, naturally they enlarge. Okay? And where they enlarge, it even cause dandy for block you way for wet. Okay, because it is part of the how people refer to and say now the plumbing system of the body of mortal man. Outside the water they pass. So it block then hold them the outside the water for pass for lay wet. It make person they wet. So sometimes person go kind of hospital, it no be wet at all. It not mean say you don't get kidney problem. It means say you get prostate problem. Now the reason okay advice, whatever problem you get, no go na pharmacy. No go na then corner place then. Come na the big hospital. Because by when you reach na the big hospital, they able to establish the problem where you get. And what you possible understand, if you get prostate problem, tendency dey for you get kidney problem. Because the moment where the prostate the block for you no go dey wet, it dey unblock the kidney. Because the kidney they overflow and then they go cause for you get kidney problem.
We dey round up the program now, Doc. What's in the advice for keep the kidney healthy?
So one of the things we need for practice good system. Wherein people need for engage in exercise. People need for the exercise more. Another thing for the practice. People for understand say we get very good doctor them na then hospital.
Make a pick this call. You name yourself call from Body Tok?
Yes, concerning citizen.
Yes, concerning citizen.
Yeah. What in way? What you propose in the water? So after some time, they begin blue fast.
Okay. Okay, thank you.
Okay.
Yeah. So exactly they talk about exercise. This person says say within the causeway somebody they work they breathe fast.
So many things. It can be kidney, it can be heart, it can be liver, it can be even your lungs where they use for blow for yourself. Okay, so many conditions where they cause dandy. Okay. For kidney, the moment where you get kidney problem, that you reach at a stage where in way workers when they blow fast, meaning you don't get serious complication. Wherein the water within your system, you don't so much boku that it don't can your lungs. Okay, where they use for blow. And where don't can your lungs, the lungs not able to expand properly for make lay blow, so you will get blow problem. But a lot of people where they get breathing problem, they work small distance, then people where they assess them properly, they find out in a heart problem they get. Okay, but you can also see them kind of thing in the people get kidney problem. But like I say, it get for be advanced because na a complication of kidney problem.
Okay. You mean they talk about the advice them, make we round up on them, on the advice them where somebody need for do or the what you need for engaging in terms of for make the kidney be kept healthy.
Yes. So overall, we just want people get a good practice, okay, good habits for their health. Exercise now one of them. A lot of people don't even get time for exercise. A lot of people. And now one of the things they really help you a lot. It help for protect not only your kidneys, even your liver, even your heart, your whole body. Exercise good. Another thing again, for people avoid smoking. It's very important.
Okay.
Smoking, they damage everything.
Thank you.
It damage the lungs, then it begin move further. Again, alcohol. People need for stop for drink alcohol. Alcohol is a very toxic something where they damage the kidney seriously. Because when they they drink excess alcohol, that was not only get liver problem, you also get kidney problem.
Including any kind alcohol.
Yes, as long as it is alcohol, okay, you get for avoid them because
including
they damage
beer, everything.
everything. Okay, it damage your kidney seriously. I know Musa is smile.
No, it's okay.
Another thing they give people for practice. People need for the drink enough water.
Okay.
I know right now they're at the month of Ramadan. For the
Yes.
Muslim then they spend close 12, 13 hours without drinking water. Okay, they do have enough for religious purpose. But please after the Ramadan, we want let people and we drink more. We want see people in the workout rubber water
Okay.
for drink.
Thank you very much for joining me in the edition of the program. Mohammed Yayaba, resident doctor, internal medicine department, University of Salon Teaching Hospital Complex. Today we talk about safety of the kidney, what you need for do every day for keep the kidney safe, and what person they do with the damage the kidney. In case you miss part of the program or the entire program, you can go back on our Facebook page as we've been there live, and also we're live on YouTube. Remember, say next week we get 100 Lions for grab with Stop Up for we listeners them. We go ask questions them on based on what we don't discuss in the edition of the program. Plenty thank you for joining we, Mohammed Yayaba.
Thank you,
and
Yolanda.
thank you very much. And then this edition of the program will Body Talk will left you. Plenty thank you to DJ Sunga, Joseph Sunga for in technical support. Fatmata Samura make una see live na Facebook, and plenty thank you to Karifa to Conte for produce this edition of the program Well Body Talk. We bring and come to you Musa Kamara na minim, and plenty thank you to we partners them University of Salon Teaching Hospital Complex, where they give we experts them every week for can discuss health issues them and raise awareness about well body in the country. So to them Musa Kamara say bye bye.